6 to 8 wet diapers a day. That's how many diapers a newborn uses. If we calculate an average of 7 diapers a day over 365 days a year, by the time a baby is leaving his toddler years, he'll have used nearly 8,000 diapers. Let's save our new parents some anxiety by not doing the math on potential cost. After that many diapers, most parents are glad to say goodbye to padded bottoms and hello, tiny toilets.
I will encourage my patients to really start potty training by the age of 3. Many children are interested before, and that's absolutely fine. I've even seen some parents, especially parents from Europe, train their children after 1 year of age, which blows my mind. But at around the age of 3, I encourage it to really start challenging your child to potty train. And that potty training is often a time-consuming, frustrating process, but it's doable. And a child that is potty trained is trained not to use a diaper during the day and the nighttime. So our goal is that at 3 years of age to have a child out of diapers during the day and nighttime.
The most important component is readiness. If you push it before the child is ready, then training might take longer and no one will be happy. You'll know when your child is ready and when they are physically capable of going to the bathroom. They can walk to the toilet, they can slide their pants up and down, and they can sit themselves on a toilet. They should also be able to follow basic directions, communicate their need for the bathroom, and be interested in the toilet. Once those readiness signs are present, you can get started. Children learn best by example.
So if you're going to start potty training your child, the first thing you want to do is show your child what going to the bathroom on a toilet is. So mom or dad, whatever the gender-appropriate parent is, should show your child what it's like to use the toilet and not use a diaper. Another trick is when your child soils his diaper, take the contents of the diaper and dump it into the toilet with your child and have your child flush it down the toilet.
Putting out a small training toilet can be less intimidating. I know I wouldn't want to climb up on a porcelain throne twice my size. Reading age-appropriate books about toilet training can also teach them about what's expected and how their bodies will feel. Then there are books for adults on how to toilet train children. There are many different thoughts and ideas and programs for toilet training. And it might take a few tries before you find the strategy that works for you and your child.
When potty training your child, be patient and don't listen to your friends. It can be very frustrating. And while one child might potty train in a week and another child might potty train in 6 months, that same child might not speak until he's 2 years old and the other child might speak when he's 1 year old. Every child develops differently at different paces. Try not to compare your child to the other children and try not to get frustrated and have patience with your child.
Know that accidents will happen. It's part of the process. Whenever anyone learns something new, mistakes happen until the skill is mastered. In this case, it just so happens that those mistakes are going to be wet pants and soiled linens. Stay calm, be positive, tell her how she will succeed next time. Always, always carry an extra set of clothes with you and be prepared to change a lot of bed sheets.
Nighttime training is often the most difficult part. I will encourage my patients not to drink close to bedtime, and especially not to drink any drinks that have sugar in them. So juice before bedtime is a sure sign that the child is going to have an accident at night. There are some children that will potty train very late. We find that this tends to run in families. There are some children that are still wetting their bed and they're 6, 7, 8 years old. And when you take a thorough family history, you find out that dad had the same problem. Regardless, dad and the children eventually do get through it and they do potty train. There is some medication that can be used for staying dry overnight. Sometimes if there's some social concerns or sleepovers or things like that that the child wants to be a part of, we can give some medication just for the night.
If you have any questions or concerns about the toilet training process, talk to your pediatrician. They've seen everything under the sun. And they might have a good tip on how to convince Junior that the toilet is our friend. They're also the ones who can determine if there are any underlying conditions that could be impeding toilet training success. When that toilet training success happens, oh boy, there's no better feeling for both child and parent. I'm Dr. Allison Suarez, and you're watching the eHealth Network. On your marks, get set, flush.